Hey everyone, Dr. Murray here at Solstice Health. Just wanted to address a few questions we've been getting with more frequency over the last several months about umbilical cord stem cells, and just explain to you a little bit the differences about the products that we offer here, which is adipose-derived stem cell therapy, which is taking an autologous source, which means it's coming from you and going back to you, versus the umbilical cord, which is coming from an outside source and then being given to you. So what we offer here, obviously, and we've refused a lot of these other products to be able to maintain the integrity of stem cell therapy and the research that's out there currently. We actually take a mini lipoaspirate of adipose or fat tissue, typically from the belly button area, and we do a multi-step process to be able to extract the stem cells from that and give that directly back to you in the same surgical procedure, same surgical day. Obviously, umbilical cord stem cells, or what they're calling stem cells, are coming in a vial. When you look at that compared to what we do, that is governed by the FDA. Anything that comes in a vial, especially if it's being taken from an outside source and given back to a different patient, the FDA does have oversight because they're involved in the development and delivery of drugs. So it's very important to understand that, because when you do look into that and dive into the FDA regulations, you will find that those particular types of allogeneic stem cell transplants must be acellular products, meaning that they have no living or viable tissue. When you compare that to what we do, we're actually taking a sample of fat tissue from you directly, processing that sample in the same day and giving it back to you. So you are getting a completely viable stem cell sample of your own tissue. So there's really incredibly minimal risk involved with that. There's no risk of rejection or anything else of that nature with the procedure that we do. And that's where the research lies right now, is using autologous stem cell or your own stem cells for you. So I think it's important to note, when you're doing your research, look at those organizations, look at the physicians who are providing it, and really look at the source of the stem cells. If you're not getting your own tissue back to you, you have to really consider who has the oversight on that. If it's coming from you to you, you have the oversight, and we have the oversight because it is the practice of medicine. But when it's coming in a vial and being injected and done over the course of, say, 10 to 15 minutes, that is FDA territory. Per their statutes, it has to be a completely acellular product. So something to be looking at as you're going out and doing your research, and we encourage research and doing your due diligence before making that financial investment. So if you have any questions at all, please feel free to reach out to us. We love spending time with patients and educating them on stem cell therapy and what we can do with that, and the potential that it has as an emerging market for your health.